My heart journey began at the age of 59. I had chest pain, nausea, and shortness of breath, and went to the ER and had blood work done, chest x-rays, and EKGs, but was told nothing was wrong and was sent home. Within 3 weeks, I also did a stress test, a nuclear stress test, an echocardiogram, and an angiogram. They showed ischemia, a 2 millimeter ST depression, and a 30% tortuous stenosis in mid-lateral anterior descending artery. Throughout the years, I've had numerous tests, visited multiple cardiologists and specialists, was misdiagnosed with GI, and I kept being told nothing was wrong. I kept advocating for myself when it seemed like nobody was listening, until I was finally diagnosed with coronary microvascular dysfunction via a provocative angiogram. I hugged the nurses when I received the diagnosis. It was not all in my head. Along this journey, I discovered a world of support groups, participated in conferences, webinars, and am part of research projects. I continue to keep notes and test results and ask questions. It's my body, and I know when something doesn't feel right.
My heart journey began at the age of 38. After years of doctor and ER visits, misdiagnosis, and worsening signs and symptoms, I was diagnosed with idiopathic dilated cardiomyopathy and congestive heart failure, and most recently, exercise-induced pulmonary hypertension, which is related to my left-sided heart disease. Although I was young and healthy, my risk factors included a family history of heart disease and hypertension, as well as preterm labor, delivery of a late preterm infant, and slight hypertension during pregnancy.
On Thursday, I had an EKG during my annual physical because I was feeling tired and out of breath. When I finally received my results the next day, the doctor said, "You've had a heart attack. You've damaged your left ventricle. You seem to have survived, so I will see you in the office on Monday." But by Sunday, I found myself in the ER. And although I presented with heart attack symptoms, I was sent back to the waiting room where I went into severe cardiac distress. 6 months later, while I was waiting as an inpatient for a heart transplant, the inequities that women face in receiving adequate care became most apparent. My husband had had a heart attack while riding his bike, and when he presented to the same ER, he was triaged immediately.
I was 37 years old when I had my heart event. It was just after the birth of my third child. One day, I felt a surge of anxiety and became violently ill. I was rushed to the hospital where I received 2 heart catheterizations. I was diagnosed with a rare type of myocardial infarction caused by spontaneous coronary artery dissection, or SCAD, which in my case was likely attributed to elevated hormone levels over multiple pregnancies.
After my open heart surgery, I started a better lifestyle of exercising and eating healthy. I participated in the cardiac rehab, which helped me exercise without fear. I had support from family and friends, and I lost 35 pounds. I was recovering and was happy, but there was something missing. Fortunately, I found out about the Women at Heart support group and enrolled as a participant. The program really helped me move on psychologically. I knew I was not alone.
A lack of knowledge has created huge gaps in diagnosing, treating, rehabilitating, and supporting women with heart disease. Knowing this, I am involved as a patient advocate and advisor with local, national, and international organizations. I also participate in research as a subject, as a collaborator on a pan-Canadian project, as a focus group member of a web-based portal, as a lay peer reviewer for grant applications, and most recently as a presenter at the University of Ottawa Heart Brain Summer School, speaking on the engagement of patient partners in research.